Hello everyone, welcome back to my YouTube channel. Today we'll study about the drugs acting on respiratory system, means the drugs which are used to treat the respiratory diseases. Here, under the drugs acting on the respiratory system, we are going to study in detail about the antiasthmatics and bronchodilators, decongestants, expectorants and mucolytics, antitussives, bronchoconstrictors and antihistamines. Okay, the first we'll study about the antiasthmatics and bronchodilators. Antiasthmatic, anti is nothing but against asthmatic. Okay, the drugs which are used to treat the asthma. Here the classification of antiasthmatics are bronchodilators, anti-inflammatory drugs, bronchodilators, anti-inflammatory drugs, beta adrenergic drugs, anticholinergic drugs and mast cell stabilizers. Okay, first we'll study about the bronchodilators, means these drugs relax muscle around airways. Okay, and bronchodilators means these drugs are used to dilate the bronchi or the bronchioles. Okay, means these drugs are helps to relax the muscles around the airways. Andre airways sutta ಏನು muscles ಇರುತ್ತೆ ಆ ಒಂದು muscles ನ relax ಮಾಡೋದು. Okay, the main function of this drug is to relax the muscles which are present around the airways. The some of the example for these bronchodilators are salbutamol, terbutalit. Okay, salbutamol and terbutalit. Next we'll study about anti-inflammatory drugs. Okay, anti-inflammation means against the inflammation. These drugs are used to treat, to reduce the inflammation. Here, inflammation means it includes the 5 cardinal signs, that is swelling, increased body temperature, swelling, temperature, pain, temporary loss of the sensations and redness. These are the 5 cardinal signs of inflammations. Means these anti-inflammatory drugs are helps to reduce the inflammations. Here, these drugs reduce the swelling and these drugs reduce the swelling and mucus production in airways. Okay, ಅಂದ್ರೆ swelling ಏನಿರುತ್ತೆ ಅದನ್ನ ರೆಡ್ಯೂಸ್ ಮಾಡಿಬಿಟ್ಟು ಮ್ಯೂಕಸ್ ಪ್ರೊಡಕ್ಷನ್ ಅಂದ್ರೆ ಏರ್ವೇಸ್ ಅಲ್ಲಿ ಏನು ಮ್ಯೂಕಸ್ ಪ್ರೊಡ್ಯೂಸ್ ಆಗ್ತಿರುತ್ತೆ ಆ ಒಂದು ಮ್ಯೂಕಸ್ ಅನ್ನ ರೆಡ್ಯೂಸ್ ಮಾಡೋದಕ್ಕೆ ಆಂಟಿ ಇನ್ಫ್ಲಾಮೇಟರಿ ಡ್ರಗ್ಸ್ ಅನ್ನ ಯೂಸ್ ಮಾಡ್ತಾರೆ. ಎಕ್ಸಾಂಪಲ್ ಫಾರ್ ಆಂಟಿ ಇನ್ಫ್ಲಾಮೇಟರಿ ಡ್ರಗ್ಸ್ ಆರ್ ಫ್ಲುಟಿಕಾಜೋನ್, ಬಿಡಿಸೋನೈಡ್ and beclomethasone. And next is beta adrenergic drugs. Beta adrenergic drugs, these drugs are stimulate beta adrenergic receptor to widen the airways. Okay, beta adrenergic receptors ಏನಿರುತ್ತೆ ಅದನ್ನ activate, stimulate is nothing but an activation. beta adrenergic receptors ನ activate ಮಾಡೋದಕ್ಕೆ ಅಥವಾ airway ಏನಿರುತ್ತೆ ಅಂದ್ರೆ wind pipe ಏನಿರುತ್ತೆ airway ನ ವೈಡ್ ಮಾಡೋದಕ್ಕೆ ಅಂದ್ರೆ ದೊಡ್ಡ ಮಾಡೋದಕ್ಕೋಸ್ಕರ ಬೀಟಾ ಅಡ್ರಿನರ್ಜಿಕ್ ಬ್ಲಾಕರ್ಸ್ ನ ಅಥವಾ ಬೀಟಾ ಅಡ್ರಿನರ್ಜಿಕ್ ಡ್ರಗ್ಸ್ ನ ಯೂಸ್ ಮಾಡ್ತಾರೆ. ಎಕ್ಸಾಂಪಲ್ ಫಾರ್ ಬೀಟಾ ಅಡ್ರಿನರ್ಜಿಕ್ ಡ್ರಗ್ಸ್ ಆರ್ albuterol, butalterol and metoprolol. And next, the anticholinergic drugs. Anticholinergic drugs, the function of this drug is block acetylcholine from causing smooth muscle contraction, from reducing the excessive mucus in the bronchi. Okay, it blocks the acetylcholine from causing the smooth muscle contraction. Okay, acetylcholine ಅನ್ನ ಯಾವ ತರ ರೆಡ್ಯೂಸ್ ಮಾಡುತ್ತೆ ಅಥವಾ ಬ್ಲಾಕ್ ಮಾಡೋದಾದ್ರೆ ಸ್ಮೂತ್ ಮಸಲ್ಸ್ ಅನ್ನ ಕಾಂಟ್ರಾಕ್ಟ್ ಮಾಡೋದ್ರಿಂದ acetylcholine ಅನ್ನ ರೆಡ್ಯೂಸ್ ಮಾಡುತ್ತೆ. and also from producing the excessive mucus in the bronchi, ಅಂದ್ರೆ bronchi ಅಲ್ಲಿ excessive mucus ಅನ್ನ ಪ್ರೊಡ್ಯೂಸ್ ಮಾಡುತ್ತೆ. and example for this is tiotropium and ipratropium. Tiotropium and ipratropium, these are the examples for anticholinergic drugs. And next we'll see about the mast cell stabilizers. Here the mast cell stabilizers, these inhibit is nothing but reduce, inhibit the histamine releases from the mast cell and reduce. Inhibition is nothing but stop. Okay, stop. It stops the histamine release from the mast cell and reduces airway hyperresponsiveness and block the early and late responses of allergens. Okay, this is the main function of mast cell stabilizers. Here, the example for mast cell stabilizers are chromoline and nedochromil. Chromoline and nedochromil. Next, we'll see about bronchodilators. Here, the bronchodilators, these relax the smooth muscles surrounding the airways, which widens them and allows for a easier airflow. Okay, bronchodilators na yaak kodbeku adu yaak administration ಮಾಡಬೇಕು. Here, it relaxes the smooth muscles. ಅಂದ್ರೆ smooth muscles ಅನ್ನ relax ಮಾಡುತ್ತೆ. Those are surrounding the airways. ಅಂದ್ರೆ airways ಸುತ್ತ ಏನ್ smooth muscles ಇರುತ್ತೆ ಆ smooth muscles relax ಮಾಡಿ and also it helps for the widening. ಅಂದ್ರೆ airway ಏನಿರುತ್ತೆ ಅಥವಾ smooth muscles ಅದನ್ನ widen ಮಾಡಿ it allows for the easier airflow. Okay, smooth muscles relax ಅಂದ್ರೆ obviously airway widen ಆಗುತ್ತೆ. airway widen ಆಯಿತು ಅಂದ್ರೆ obviously the person is having the easier airflow. Okay, ಅಂದ್ರೆ ಇವಾಗ asthmatic patients ಅಲ್ಲಿ ಏನಾಗಿರುತ್ತೆ easier airflow ಇರಲ್ಲ. ಅದರಿಂದಾಗಿ they because of that they are having the breathing difficulty. Okay, airway block ಆಗೋದ್ರಿಂದ breathing difficulty ಇರುತ್ತೆ. If you administer the bronchodilators, it relieves the symptoms of asthma. Relieves symptoms of asthma. ಅಂದ್ರೆ asthma symptoms ಏನಿರುತ್ತೆ ಅದನ್ನ ರಿಲೀಸ್ ಮಾಡಿ he can breathe and breathe normally. He can breathe normally. Okay, so next we'll see about the classification. Bronchodilators are classified into three types. Those are sympathomimetics, methylxanthines and anticholinergics. Sympathomimetics. Example for this sympathomimetics is salbutamol and terbutaline. And example for methylxanthines is theophylline. And example for anticholinergic drugs is ipratropium bromide. As you know, the bronchodilators are divided into three types. Okay, here first we'll see about the beta 2 sympathomimetics. Okay, already you know the bronchodilators, these drugs are used to relieve the mucosal decongestants in the airways and by widening and relaxing of the smooth muscles. Okay, bronchodilators. Here the beta 2 sympathomimetics, example for this beta 2 sympathomimetics are salbutamol, terbutaline, bambuterol, salmeterol and formoterol. So here the salbutamol, the dosage of the salbutamol is 2 to 4 mg orally in the form of tablet or syrup, and 0.25 to 0.5 mg IM or subcutaneous, and 100 to 200 mcg by inhalations, means these drugs are taken by the inhaler also. Here the salbutamol is present in the form of tablet, syrup, injection as well as inhaler. Okay, it is available in the four forms: tablet form, syrup, injection and as well as in the form of inhaler. And next the terbutaline, the dosage of terbutaline is 5 mg orally and 0.25 mg subcutaneous and 250 mg by inhalations, means these drugs are also present in the form of tablet, or it is available in the form of tablet, in the form of injections and in the form of inhaler. And next is bambuterol. Here this drug is, the dosage of this drug is 10 mg to 20 mg tablet per orally. And next drug is salmeterol. It is present only in the form of 25 mg inhaler. Okay, salmeterol, it is present only in the form of, or it is available in the form of inhaler. And next is formoterol. It is available in the two forms, that is in a Foratec and in a Deriform. Foratec and Deriform. Here the Foratec, the 12 mg Rotacaps, and Deriform, it is 12 mg per pop, means it is available in the form of capsules as well as in inhalers. Okay, these are the examples and the dosage. So next we'll see about the mechanism of action Okay, the mechanism of action is nothing but when you administer these drugs, how these drugs are going to act in the body. So here the mechanism of action of these bronchodilators are, these are acts as a selective beta 2 adrenergic agonist. Agonist is nothing but these drugs are mimic the action of neurotransmitters. When these drugs are going to act or mimic the action of neurotransmitters, these are produces the hormones. Then it stimulates the beta 2 receptors in the lungs. Okay, it acts as a selective beta 2 adrenergic agonist act agata. Next, stimulate is nothing but an activate. It activates beta 2 receptors in the lungs. Okay, beta 2 receptors in lungs alli irutte, adanna activate ಮಾಡುತ್ತೆ. Then it leads to resulting in relaxation of the smooth muscles in the airway. Okay, ಅಂದ್ರೆ ಸ್ಮೂತ್ ಮಸಲ್ಸ್ ಏನಿರುತ್ತೆ ಏರ್ವೇಸ್ ಅಲ್ಲಿ ಆ ಸ್ಮೂತ್ ಮಸಲ್ಸ್ ಅನ್ನ ರಿಲ್ಯಾಕ್ಸ್ ಮಾಡುತ್ತೆ. when these are relaxed, when these affect on the smooth muscles, obviously the airway is going to relax by widening. Okay, widening ಆಯಿತು ಅಂತಂದ್ರೆ here the patient is reduces the symptoms of asthma. Symptoms of asthma. Once the symptoms relieves, he is having the normal respiration. Normal respiration. Okay, this is the mechanism of action of bronchodilators. Next we'll see about the indications, means in which conditions we should administer the bronchodilators are the beta 2 sympathomimetics. ಅಂದ್ರೆ beta 2 sympathomimetics ಅನ್ನ ಯಾವ condition ಅಲ್ಲಿ administer ಮಾಡಬೇಕು. Here for the treatment of asthma and COPD. COPD is nothing but a chronic obstructive pulmonary disease. Chronic obstructive pulmonary disease. Okay, ಈ ಒಂದು conditions ಅಲ್ಲಿ beta 2 sympathomimetics ಅನ್ನ ಯೂಸ್ ಮಾಡಬಹುದು. And next is contraindications. Here the contraindications means in which conditions we should not administer the beta 2 sympathomimetics. Here the heart diseases, uncontrolled high blood pressure, hyperthyroidism and hypersensitivity reactions. Okay, patients ಏನಾದರೂ heart disease ಇದ್ರೆ ಅಂತ conditions ಅಲ್ಲಿ drugs ಅನ್ನ ಯೂಸ್ ಮಾಡೋದಿಲ್ಲ. ನೆಕ್ಸ್ಟ್ ಅನ್ಕಂಟ್ರೋಲ್ಡ್ ಹೈ ಬ್ಲಡ್ ಪ್ರೆಷರ್ಸ್, ಅನ್ಕಂಟ್ರೋಲ್ಡ್ ಹೈ ಬ್ಲಡ್ ಪ್ರೆಷರ್ಸ್ ಇದ್ದಾಗ ಯೂಸ್ ಮಾಡಿದ್ರೆ ಏನಾಗುತ್ತೆ, ಅಗೇನ್ ದ ಪೇಷಂಟ್ ಮೇ ಗೋ ಫಾರ್ ದ ಟೆಕಿಕಾರ್ಡಿಯಾ. Tachycardia is nothing but an increased pulse rate. Pulse rate obviously increase ಆದರೆ next the blood pressure is also going to increase. And next is hyperthyroidism, increase the level of the thyroid. And next hypersensitivity reaction means the patient who are sensitive towards the sympathomimetics ಆ ಒಂದು patients ಗೆ drugs ನ administer ಮಾಡೋಂಗಿಲ್ಲ. Contraindications. And next we'll see about the side effects. Side effect of beta 2 sympathomimetics are throat irritations. ಅಂದ್ರೆ ಡ್ರಗ್ ಅಡ್ಮಿನಿಸ್ಟ್ರೇಷನ್ ಮಾಡಿದ್ಮೇಲೆ ಏನಾಗುತ್ತೆ, ಪೇಷಂಟ್ ಮೇ ಫೀಲ್ ದ ಥ್ರೋಟ್ ಇರಿಟೇಷನ್ಸ್, ಅಂದ್ರೆ ಗಂಟಲು ಕಿರಿಕಿರಿ ಆಗಬಹುದು. ನೆಕ್ಸ್ಟ್ ಟ್ರೆಮರ್ and headache. Palpitation is nothing but an audible of own heart sounds. Are the audible of own heart sounds. ಅಂದ್ರೆ heart beats ಜೋರ. And next is nervousness or in a restlessness. And next is dizziness. Okay, these are the common side effect of sympathomimetics. And next we'll see about the role of nurse. Here the nurses are playing a major role in a healthcare delivery system because they are always there within a patient's for the taking care. So the nurses here, some of the rule of the nurse are the responsibility of the nurse while administering and after administration of the drugs. Here first of all she should follow the 10 rights of drug administration. Okay, drug administration 10 rights ಏನಿದೆ ಅದನ್ನ nurses follow ಮಾಡಬೇಕು. Next monitor for the therapeutic responses. ಅಂದ್ರೆ patients therapeutic response ಅನ್ನೋದೇನು ಬರೆನ after the administration therapy ಅಂದ್ರೆ ಟ್ರೀಟ್ಮೆಂಟ್ ಕೊಟ್ಮೇಲೆ patients ಏನಾದರೂ side effects ಏನಾದರೂ ಇದೆಯಾ, ಓಕೆ ಪೇಷಂಟ್ಸ್ ಏನಾದರೂ ಸೈಡ್ ಎಫೆಕ್ಟ್ ಆಗಿದೆ ಅದರಿಂದ ಅಂತ ಹೇಳ್ಬಿಟ್ಟು ಐಡೆಂಟಿಫೈ ಮಾಡಬೇಕು. ನೆಕ್ಸ್ಟ್ ಅಸೆಸ್ ದ ಸಿವಿಯಾರಿಟಿ ಆಫ್ ಕಂಡೀಷನ್ಸ್, and the severity of condition is nothing but an asthma. Okay, asthma the severity ಏನಿದೆ ಅಂತ ಎಷ್ಟಿದೆ ಅಂತ ಐಡೆಂಟಿಫೈ ಮಾಡಬೇಕು. mild, moderate, severe. Okay, and next is monitor the vital signs. Vital signs na yak monitor ಮಾಡಬೇಕು. Whether if the patient is having the uncontrolled blood pressure, you should not administer the sympathomimetics. And next is collaborate with other healthcare team. Obviously the nurses is working in the team. Okay, other medical teams like the doctors and other nursing staffs, as well as paramedical and non-medical staffs also. So these are the rules of nurse. Next we'll say about methylxanthines. So these drugs are comes under the bronchodilators. The indications means in which conditions we should use the bronchodilators. Those are methylxanthines. Indications are used for the bronchial asthma, means these drugs are used for the treatment of bronchial asthma and chronic obstructive pulmonary diseases and breathing difficulty in premature infants, because in a premature infants there is a lung immaturity, means lungs are not mature yet. And next, central nervous system stimulants. Diuretics. Diuresis is nothing but increase the production of urine. Increase the production of urine. Okay, and next is decrease release of histamine. Here histamine, it causes the excessive production of the mucus. Okay, histamine, it causes increased production of the mucus. Production of mucus, and also this increased production of mucus may causes the inflammation in the airways. When we administer these methylxanthines, these drugs are going to decrease the release of histamines. And next is smooth muscle relaxant and enhances the gastric acid secretions. These are the indications of the methylxanthines. And next example for this is theophylline and aminophylline. Next we will see about the mechanism of action of methylxanthines. Means it enhances the release of stored calcium from the endoplasmic reticulum of skeletal and cardiac muscles. It enhances is nothing but improves. It improves the release of stored calcium from the endoplasmic reticulum of skeletal and cardiac muscles. Then it leads to increase the level of CAMP. CAMP is nothing but cyclic adenosine monophosphate. Cyclic adenosine monophosphate. Cyclic adenosine monophosphate. The function of this cyclic adenosine monophosphate is also a nucleotide that regulates many cellular functions. With CAMP, it helps for the many cellular functions and brain functions, as well as for the gene expressions. It helps for the brain function, gene expression, and other metabolic functions. And also it helps for the cellular signals. Okay. Then here it is going to increase the level of cyclic adenosine monophosphate by inhibiting, means by decreasing or the stopping the phosphate diesterase enzyme. Then it leads to blocks the action of adenosine, means the adenosine, it makes or it does the function of adenosine is to bronchoconstriction. Okay, it makes the constriction of the bronchioles. When you administer these bronchodilators, the constriction is going to reduce and the airway is cleared. Okay, if the airway is clear, there is a normal respiratory functions. This is the mechanism of action of the methylxanthines. Next we'll see about the dosage, side effects, and drug interactions of the methylxanthines. Those are theophylline and aminophylline. Here the dosage, depending on age, weight and medical conditions and responses to a treatment. Okay, dosage, it is completely depending on the age, weight and medical conditions and responses to the treatment. Here the availability means these drugs are available in the form of tablet, capsules and in solutions. Tablet, capsules and solutions. And here the side effects ಅಂದ್ರೆ drug administrations ಮಾಡಿದ್ಮೇಲೆ ಏನೇನು side effects ಆಗುತ್ತೆ patients ಗೆ. Here the CNS side effects, CNS central nervous system side effects. The patient may feel the dizziness or the vertigo or the visual disturbances. These are the common central nervous system side effects, or sometimes the patient may feel the sleepiness. And next is arrhythmia. Arrhythmia is nothing but an abnormal heart sounds or an abnormal heartbeats. And nausea and vomiting, these are more common for the each and every drugs. And palpitations. Palpitation is nothing but an audible of own heart sounds. And seizures. These are the common side effect of methylxanthines. Next we'll see about drug interactions. Drug interaction is nothing but these drugs are going to act with another drug. Here these phenytoin, rifampicin, phenobarbital will increase the metabolism of theophylline. Means these drugs phenytoin, rifampicin, phenobarbital ee drugs ಏನು ಮಾಡುತ್ತೆ theophylline ನ metabolism ನ increase ಮಾಡುತ್ತೆ. And next erythromycin, ciprofloxacin, cimetidine, allopurinol and oral contraceptives decreases the metabolism of the theophylline. ಅಂದ್ರೆ phenytoin, rifampicin, phenobarbital ಕೊಡಬೇಕಾದ್ರೆ we can administer the methylxanthine, so the theophylline and aminophylline. But when we are administering the erythromycin, ciprofloxacin and cimetidine and allopurinol, these drugs are going to decrease the metabolism of the theophylline. Okay, or decrease the action of theophylline. These are the drug interactions. Next we'll see about the anticholinergics. These drugs are used for the treatment of the severe asthma as well as chronic obstructive pulmonary diseases or other respiratory diseases. Here the example for the anticholinergics are ipratropium bromide. The indications, in which conditions we should administer this ipratropium bromide. Here the indications are severe asthma, bronchospasm, chronic bronchitis and emphysema. In the severe asthmatic conditions and bronchospasms. Bronchospasm, it leads from the COPD. COPD is nothing but a chronic obstructive pulmonary disease. Means here there is an obstruction of the airways. It may causes the bronchospasm. And chronic bronchitis. Bronchitis, itis is nothing but an inflammation of the bronchioles. In chronic inflammation of the bronchial conditions, we should administer the ipratropium bromide as well as emphysema. Emphysema is nothing but an air-filled tissues in a pleural cavity or in a lungs. And next we'll see about the dose and the route of administration. Ipratropium bromide, it is available in the form of inhaler. Okay, inhaler. Inhalation is usually 2 puffs. Means that is 20 mcg per puff. Puff andre in patients inhale andre inhalation and box ಬರುತ್ತೆ. Inhaler ಅಲ್ಲಿ ಆ ಟ್ಯಾಬ್ಲೆಟ್ ನ ಕ್ರಶ್ ಮಾಡಿಬಿಟ್ಟು inhale ಮಾಡೋದು ಟ್ಯಾಬ್ಲೆಟ್ಸ್ ಅನ್ನ. Means ಏರ್ ಏನಿರುತ್ತಲ್ಲ ಏರ್ನ ಬಾಯಿಂದ ಸೇರ್ಬೇಕು. Okay, that is 2 puffs and 2 puffs ಅಂದ್ರೆ per day 2 puffs ಅನ್ನ ಕೊಡಬಹುದು. That 1 puff includes 20 mcg and through the MDI. Okay, through MDI and administer 3 to 4 times per day. ಅಂದ್ರೆ 1 puff 20 mcg ತರ 1 day ಗೆ 4 times ನ ಯೂಸ್ ಮಾಡಬಹುದು. ಅಂದ್ರೆ 20 up to 80 mcg ವರೆಗೂ ಯೂಸ್ ಮಾಡಬಹುದು. Here the MDI is nothing but a meter dose inhaler. Meter dose inhaler. Okay, this is the dose and route of administration of the ipratropium bromide. Next we'll see about the side effects. Okay, usually after the administrations of the drug, the patient may feel the dry mouth, throat irritation, cough, hoarseness of voice and the voice change ಆಗುತ್ತೆ. And next the patient may feel the headache, blurred vision and next palpitation, audible of the own heart sounds and urinary retention and allergic reactions. Sometimes the patient may feel the hypersensitivity reactions with rashes or itching. Okay. So next we'll see about the nurse's rule while administering before and after administration of the anticholinergic drugs. Before that, the nurse should know about the patient's conditions or the medical history, and also she should know about the age and severity of the disease conditions. And after the nurse's release, the nurse should know about the 10 rights of drug administration and the route of the 10 rights of drug administration. And also before administration of the drugs, she should check the complete vital signs of the patient. If the patient is having tachycardia, she should not administer the ipratropium bromide, because again it may causes the palpitations. Okay, again it may causes the palpitations, means already the patient is having, after administration the patient may have the chances of the palpitation. If the patient is having the increased pulse rate or the tachycardia, again the condition may be worsened. Okay, these are the common rules and responsibilities of the nurse. So here we have finished about the bronchodilators. Bronchodilators are anti-asthmatic drugs and bronchodilators. Under bronchodilators, we have studied sympathomimetics, methylxanthines, and anticholinergic drugs. Next, we'll see about decongestants. Okay, the meaning decongestant. D is nothing but a decreasing the congestion. Decreasing the congestion. Here, why the congestion occurs? Because of it may be an upper respiratory tract infections or any rhinitis or sinusitis. Okay, decongestions means these drugs. These are the type of medications that can provide a short-term relief for a blocked or the stuffy nose. Okay, decongestants. These are the medications that can provide short-term relief from the stuffy or running nose. Right? Nasal secretion in the nose in block relief kodutte. So that medications are called as decongestants. Congestants here, the decreasing the level of congestions. So indications of these drugs. These drugs are administered during colds, allergic rhinitis, sinusitis and flu and fever and other allergic conditions and other upper respiratory tract infections causing the congestions. These are the indications of the decongestants and types. Types are nothing but these drugs are available in the form of nasal spray, drops, tablet or in a capsule, liquid or syrup. And next we'll see about the mechanism of action. These drugs are using as a decongestants, means to reduce the congestions or the secretions in the nasal cavity. So here the mechanism of action is they reduce the swelling of blood vessels in the nose. Okay, why the congestions occur? Because of the increase or the swelling of the blood vessels. Okay, inflammation of the blood vessels the nasal congestions. So here when we administer these drugs, those are going to reduce the swelling of the blood vessels in the nose. Okay, then it leads to, which helps to open the airway open agata. Okay, swelling reduce aitunda, obviously there is an airway going to open. So once the airway opens, there is a normal respiratory functions. Okay, this is the mechanism of action. Means they reduce the swelling of the blood vessels in the nose. Blood vessels in swelling then reduce manata. Then it leads to, which helps to open the airway. Blood vessel swelling kamme aitundra. Obviously there is an opening of the airway. Once the airway opens, there is a normal respiratory functions. And next we'll see about the contraindications. Okay, these drugs are not safe, or in which conditions we should not administer these drugs. Here contraindications are decongestants should not be administered to a children below 6 years of age. Okay, 6 years children senior already decongestants na administration ಮಾಡಬಾರದು, because sometimes it may causes the tachycardia or the increase the pulse rates. Okay, and next is 6 to 11 years of children should take them up to 5 days. 6 to 11 years children only they have to take for the 5 days. 5 to 7 days matra drugs na tagobeku. And next we'll see about the side effects of the decongestants. Here the side effect are nasal irritations, because these drugs are administered to nasal cavity, nasal irritation, dry mouth and feeling of restlessness and sickness. Because Because of the nasal irritation, dry mouth and a feeling of restlessness, the patient may feel the sickness. Okay, these are the side effects of the decongestants.